Secret number 5, you need to be able to set the stage for the close. So there's literally 2 reasons you won't make a decision to use our services at this time. Okay, and so this is one of the example of the closing techniques that I have. After you've done a presentation and they said they'll think about it, always make sure that somewhere in the middle of the presentation, we say this. And you should use this. So write this down. There are only 2 reasons you won't make a decision to use our services at this time. 1, you are not the decision maker. Number 2, you can't afford it, or you're not the right prospect. So which one is it? Look, when you ask this question, you're gonna literally use this when you're doing a presentation. Like, look, you're not, there are only 2 reasons you won't make a decision to use our services at this time. You are not the decision maker, you can't afford it, or you're not the right prospect. Now, you're probably looking at me like, oh my God, Michael, how dare you ask this, or say this to another person? Look, you're doing a presentation right now. You're trying to be able to ask for services to have them start, using your products. Yet, here's the person telling you that, you know what, we don't have any referrals right now, or we're not at this time to make a decision on who or should we transfer our patient to another agency. So you want to be bold right there and then. This is one of those bold techniques that only the bold people can actually say. And, if you're not used to this yet, if you're not willing to be bold enough to use this, I'm going to give you guys a option B to be nicer, okay? So there's only 2 reasons why at this moment that you're not going to be able to refer patients to us. Either number 1, I haven't shown you enough to be able to get that decision, or number 2, you haven't asked me what I can do for your company. So that is more a mild way of the presentation. And so what you're doing there is you're setting the stage for them to be able to answer that. Well, if you ask them the question, you haven't asked me what you can do, what they may ask you guys next is that, well, what can you do for our company? What you're doing there is you're buying yourself time to then represent your organization, your services, your product, because already they're thinking that they're not referring to you. So what you're doing is you're buying yourself time, because the more, if they're stalling you or they're trying to push you away, you need to put yourself and keep yourself in that close. So, that's option B if you're not ready to use the first thing I shared with you guys. I want to be able to express to you guys and to be able to give you guys some of the techniques that has worked for me and for a lot of other people. And remember, I told you guys, a lot of the times people are not getting the close or not getting referrals because they're not willing to pressure. Like, we have to pressure a little bit. Sometimes we have to pressure a lot. And that's how and what makes the most successful marketers and liaisons out there become successful compared to the others who are not successful. There's actually a study that I've heard is so amazing, and it's so true, that 80% of the patients out there, all right, or potential clients, are being serviced by the 20% of home health and home care companies. So 80% is going to the 20%. Whereas 20% of the patients are being shared with 80% of the home care companies, right? So that's why you see some companies with the 500, 600,000 people census, and you're seeing some companies who are only having 10, 15, 20, and sometimes none. So that is how business is sometimes. It's called the 80-20 rule, that honestly in business, that's how it is. What we need to do is to be able to get you guys to be bolder and start asking and getting those referrals.